joining as we're gathering here physically dispersed and virtually connected. I think it's nice to reflect a moment on the meaning of place, and in doing so, recognising the traditional custodians of the lands from which we're all joining today. And I'm joining you from the lands of the Dalrol people in the northern Illawarra, and I pay my respects to their elders past, present and emerging. I would also like to acknowledge all of the Aboriginal and Torres Strait Islander people that are joining us here today. So my name is Lucy Wright-Chetnick, and I'm the co-director of the Australian Prevention Partnership Centre. So we're a national collaboration with researchers, policymakers and practitioners looking for innovative solutions to help us prevent the chronic burden of chronic disease. And we support research and research translation, and particularly focusing on building opportunities for the next generation of prevention researchers, policymakers and practitioners. So PreventionWorksLIVE is, as many of you know who've joined us for a number of this year, it's a webinars that we've set up to provide opportunities for us to hear from some of Australia's leading innovators and change makers in prevention. So it's sort of a window into some of the behind the scenes thinking and challenges and solutions that our speakers have identified and overcome. And it's the sort of insights that you don't normally see in a scientific paper or necessarily hear from a conference presentation. So as I mentioned today, we've got two guests, Sandro Demaio, who's the CEO from VicHealth, the Health Promotion Foundation in Melbourne. And he'll be speaking on global impacts to local action, the top 5 lessons for driving systems change. And we'll also have a response from Dr. Catherine Culleton from the University of Queensland. So I'm just going to take a minute or two just to tell you a little bit about Sandro and Catherine. So Sandro's worn many different hats in public health. He's a doctor, he's a renowned public health advocate. He's worked internationally with the World Health Organization and founded some of the most significant leading global and local, but global movements. So including things like NCD Free, which is a huge social movement against chronic disease that reached over 2.5 million people in the first 18 months, which is an amazing achievement. He also led the Eat Lancet Commission on healthy diets, looking at sustainable food systems. And again, it received a huge amount of global attention, both from research and from public and private sectors. And now as the CEO of VicHealth, he'll be talking to you about how he and his team are leading some really collaborative, innovative projects to support the health and well-being of Victorians. So I'd have to say Sandro is a master of engaging the public and public health communication and leveraging the power of social media for public good. And also it'd be nice, maybe if we have a bit of time, you can tell us about your most joyful recent social movement of solidarity pancakes. I'm sure there'll be a few questions about that. Also a brief introduction to Catherine Culleton. So Catherine is a senior research fellow in the School of Public Health at the University of Queensland. She's also worked in many different public health settings in Australia and the UK, including working and studying at the University of Cambridge, where she studied the relationships between nutrition researchers and the food industry. And much of her current work looks at why evidence does or doesn't get translated into policy and understanding how advocates can better influence nutrition policy. So welcome, Catherine, and thank you so much for participating today. So just a quick outline of the format. We'll invite Sandro to speak to us for 10 or 15 minutes. Then Catherine will respond for about 5 or 10 minutes, and then we're going to have an informal sort of fireside style chat with input from you in the audience. So if you want to participate and contribute questions, then go to Slido and enter the code prevention. Maybe Ellie, you could put that into the chat for those people who might not be sure how to get there. So we'll incorporate some of the top questions. If you don't want to pose your own question, you can vote some of the ones that you like further up, and we'll incorporate some of those into the Q&A. But Catherine and I will also ask Sandro a variety of questions, and I'll ask Catherine and Sandro questions. So it'll be very informal, and we'll just see how we go. So on that note, I'll hand over to you, Sandro. I think you're going to take control of the slides and share some of your wisdom with us. We really look forward to hearing from you. Thanks.
Thanks very much, Lucy. And I'll just start also by acknowledging the traditional custodians of the land that I'm on, the Wurundjeri people of the Kulin Nation and their elders past, present and emerging, and also acknowledge that the land that I'm on and live on and work on always was and always will be Aboriginal land. And finally, also acknowledge, of course, any Aboriginal, First Nations, Torres Strait Islander leaders, academics, who are joining us today, and health promotion leaders joining us today across Australia and maybe beyond. It's a real pleasure to be here. It's a topic I'm deeply passionate about. I don't have all the answers. I'm still working them out myself. So to be sharing wisdom's probably a bit hyperbolic, but I'm very happy to share my many mistakes and a few things that I've learnt along the way. So I'm going to talk about my, I could really talk about systems change for hours. So 10 or 15 minutes is really tough. But what I want to talk about is some of the work that I suppose what I'm doing at VicHealth and what we're doing as a team at VicHealth, how that reflects lots of learnings and things that I've done well and not done well, and learned from over my, my time in public health so far. So we know that the pandemic has disrupted our lives in every dimension, and we've run 2 rapid pulse surveys here in Victoria, about 2,000 people each time, to inform policy and also to inform real time in what we do and how we invest to support Victorians during this time. We know that we've seen a doubling of food insecurity, but then we've also seen more Victorians turn to making food and return to the kitchen than ever before. Even that is an interesting and complex thing to unpick. In part, we've seen people, the global movement of sourdough baking, and yet the majority of people are actually returning to the kitchen to save money. At the same time, those financial pressures are also seeing young children increase their sugary drinks consumption, and we're also seeing families turn to processed food as a way to make ends meet. So I suppose the point that I'm trying to make is that, there's this complex interweb of consequences that have resulted from what is a major shock to our modern global and local system. Now, when I talk about systems, we talk about systems in 3 different ways. And I apologise, I realise now my slides through this program of having them controlled by you, Lucy, are not quite I can see that the fonts are a little bit distorted. So just bear with me, but you'll get to see you'll understand what the slide's about. So when I think about systems for public health, and when we think about systems as an organisation, I think about three systems. I'm not a systems academic. I come to it from a very practical lens. I come at it, originally as a doctor, where our minds and our training is really about the interplay between multiple complex and interdependent systems. The cardiac system, the renal system, the respiratory system, each of them incredibly complex, but in themselves interdependent across different systems. And public health is exactly the same. So we ourselves, VicHealth, we're working very hard to make sure that we are a sophisticated but well-tuned system. We have different levers, our government relations team, our research investments, our programmatic and pilot investments, our major social marketing campaigns, our platforms across local government. All of these are different levers that need to work in a systems way for a targeted outcome. And it's about getting those different pieces working in unison for that really important outcome of improving the health and lives of Victorians. The second system, though, which we are obviously part of, is the health promotion system, the ecosystem that we all are part of. So how do we invest in that sector? How do we make sure that as a system is working as effectively as possible? Duplication is a waste of time and energy. So is competition. There are more than enough problems for us all. 2030 is fast approaching. All of our major metrics are going backwards. So there's more than enough work for everyone. How do we get that ecosystem working really well? And then the final one that I think of in terms of the 3 systems we try to influence and work within is a system that sits around the individual and that ultimately leads to the health that they do or do not enjoy. And we know we talk about these as the social determinants. We developed the FAIR Foundation framework. It's really this concept that it is actually the interplay between multiple cultural, social, commercial, political, economic drivers that ultimately result in an individual's health. It's not just, it's not the choices that they make at that individual level. So I suppose my 5 key lessons, just to jump straight to kind of the crux and then give you a couple of examples. I think the first is, as an agency, as an individual, really learning to be a better, and by better I mean a true, authentic, humble partner to communities and ultimately to the individuals that you're trying to work with and serve. This was a lesson I learned from NCD Free, and the NCD movement globally, very biomedicalized, very abstract approach to a global challenge that kills 47 million people each year. What we did instead was to put a face and a name to that global pandemic, make it personal, really understand and connect with communities, and really base it around lived experience. The second is acting on issues of privilege, power, and structural inequity. And I know that each of these are a huge area we could explore, but how we've been doing some very deep thinking as an agency. If we are an agency that is truly trying and here to serve the diverse needs but also lived experiences of Victorians, we too need to reflect that diversity. We need to address the power imbalance as a big government agency holding economic and other forms of power, and understand that really the hero in the story of the work that VicHealth does is the community. And we've learned this across the pandemic as well. It's been those local leaders, the lived experience, and the place-based approaches that have been most effective in reaching populations, getting tests up, and getting people vaccinated. Data is critical, but data for what purpose? I think data needs to be agile, it needs to be real time, it needs to allow continual self-reflection, adaptation, and innovation. We have just gone through a process of moving from an agency that was largely built for, I would say, a media environment that was at least 5 or 10 years ago. We realise we need to take health promotion information to where people are at. So, and we need to present it in a form that is emotive, modern, and cutting edge. So we are now a digital first agency. We have in-house design, digital content teams. We have a podcast in our new offices. This is all about ensuring that we continue to reflect and innovate as society changes. Investing in the systems for systems change. So we spend a lot of time and energy investing in our partners, investing in how do we build the capacity, the capability, and also the partnerships to drive systems change. Systems change is not delivered by one individual or one organisation. It's multiple levers pulled in unison across multiple partners and platforms. And so how do we strengthen others? How do we bring that systems lens? How do we create trust in the ecosystem, in the health promotion ecosystem? And how do we bring it to people's attention that actually it is a wider system that ultimately reflects and results in people's health? And finally, you can't do this without embracing complexity and intersectionality. It is a messy business working in public health. And I think, as soon as you try to put it into a silo, put it into a pigeonhole and make it discrete, it starts to become irrelevant and I think far less effective. So some examples, obviously system change. I love the idea of keep the goal really clear, but keep the what clear, but keep the how flexible. And so one of the things that we did last year, contributing to the national dialogue, was to publish this in the Medical Journal of Australia. And it was really looking with, and I didn't do this. This was 65 experts, many of whom probably are on this call, and thank you again for your intellectual leadership and contribution. We simply convened it. But we asked, leading experts, how do we get to health for all by 2030? And then let's sort of create some form of a manifesto so that we know as a system, as an ecosystem, what we're actually working towards, setting a common end goal. We've also brought this very practically, though, into our own work. So in the middle of the pandemic, we had the opportunity to reimagine the way we work as an organisation. In the past, we had an office in Carlton, a fairly affluent part of Melbourne, outside of easy transport hubs, and in suburban Melbourne. People who wanted to use our space would come to us and ask us and we would give them a space. Now, VicHealth, we belong to the people of Victoria. We are a public good. Our agency is a public good, and that's what we exist to do and serve. So when we when we had the opportunity to move offices, not only did we move to a space that was on the doorstep of the major transport hub for regional Victoria into the free tram zone so that our partners could then get to us more easily, but we also flipped the idea of an office on its head. And so we created the Victorian Health Promotion Hub. It's a fully accessible digital and hybrid environment. It has a podcast studio, working spaces, boardrooms, a big kitchen. And the idea is that we take the space within the hub that we need to run VicHealth, but the rest belongs to the ecosystem. And so any health promotion partner, particularly from regional Victoria, is able to digitally and remotely log in, book a space, use our end of trip facilities as they arrive in from Mildura or Ballarat or Bendigo, have a shower, have some meetings, go into the department, visit others, come back, pick up their luggage and go back home. And we become then, fully integrated into the ecosystem and start to break down some of those barriers of power and privilege by actually saying, well, look, at the end of the day, our space is your space. Systems-based approaches, though, there isn't a single approach, but we have heavily embedded this in a new partnership, statewide local government partnership that we've launched recently. So we again, completely reimagined the way we work with this level of government. We brought all of the partnerships under one central platform within VicHealth to make far lower transactional cost. And we launched a partnership with 16 councils, what we call fast track councils, 5-year investment around the health and wellbeing of young people. And it starts with a systems mapping exercise. We map that local system with leaders. We then have communities of practice, monitoring and valuation support, financial support to actually put people on the ground. So it's capability building as well, and a whole bunch of other things that we bring around that systems map-based plan that is fully place-based, but delivering on a central set of strategies around the health and wellbeing of young people. And I can share more. I'll share more with the Sachs Institute to then send out on our VLGP. The other major investment I want to talk about just very quickly is Future Healthy. So this is a $45 million investment in young people wellbeing and recovery. And the way we've gone about this is, again, it's about systems change for young people. So it's working with a huge number of different partners, but most importantly, it's actually embedding the lived experience of young people at the start. So usually we would go out with a package of interventions developed by experts and then implement them, and maybe there'd be some sort of opportunity for influence by young people along the way. Instead, what we've done is to actually launch this program with the largest crowdsourcing effort we've ever undertaken through social media and through some key media partners that reach young people, including pedestrian TV. And so what that means is that thousands of young people are being currently across Victoria through social media are being asked the question, what does health mean to them? What are the major barriers that stand between them and good health? And how can we help to eliminate those barriers? And we will use that data along with population data and evidence to be able to then build out this $45 million package that we're officially launching statewide next week. And the last piece I just want to touch on is our research fellowships program. Again, we've kind of reimagined. So, how do we build capability? How do we build systems leaders in the health promotion sector? And one of the key learnings, I think, is that they have to be highly translational. So we need to encourage scientists really to be embedded in and working in communities and in the policy space. And so what we're funding as of this year is 4 3-year postdoc fellowships per year. So 12 in total at any one time that will be translational research fellowships. So they spent half their time at VicHealth and half their time embedded in a research institution working on a 3-year practice and research question that we co-develop with our partners. And that's just kicking off at the moment, but we're hoping that this will develop, more systems leadership and really focusing on building the leadership role of translational science. And of course, we continue to be a collaborating centre. We are the first non-national government entity to partner directly with UNICEF at the global level around the health and wellbeing of children. We announced that major partnership last year. And this comes back to, I think it's about thinking about that global and the local. How do we continue to, I think many of the world-class institutions. When I was at WHO, I was always given a hard time because I was commissioning a lot of work from Australia, and everyone thought I was biased. But actually, it's just because we have some of the best research institutions in the world, including SACS and TAPC. And so I think the obligation of us not only to think about how do we continue to build the health and improve the health and lives of the communities we work with, and challenge and rethink the models that allow us to do that, and the systems-based approaches, the methodologies themselves, but also how do we continue to make sure that we contribute to the global science and practice of public health more broadly, and ensure that not only the work we do, but also how we do that is something that we continue to contribute to that global stage. So bit of a random hodgepodge of thoughts, but I'm sure it'll lead to lots of questions. So back to you, Lucy.
Wonderful. Thank you so much, Sandra. That's really great. And Karen, if you could get control back, maybe you could put up the slide with Slido details. So if people do have questions, they can start to post those. And we'll go to you, Catherine, for a response and just some reflections.
Thanks, Lucy, and thank you for inviting me here today. Thanks, Sandra. That was a fantastic presentation and really thought-provoking, and approaching systems change from a different perspective. I guess from what I normally think about systems change because of just the way that my mind works. And so I thought I'd talk a little bit about that, and I'd really love to get your reflections on that side of things. I mean, when I'm thinking about systems change, I was really, really pleased to hear you speak about, your approach to power and privilege, because to me that underpins, why we're stuck in the current model that we are, and it seems so challenging to change that model. And I guess to me, when we look at those levers of change, ultimately we've got politicians who are really holding a lot of those levers, but then we've also got that power of the corporate sector as well, and how they are, influencing politicians and influencing our current system so strongly. And so it would be wonderful to hear about VicHealth's approach to that. I guess the other lever that I think is really important to systems change, and you touched on it a lot, was this concept of engaging the community and the role that the public plays in potentially influencing systems. And I think in public health, we've got a real opportunity to expand on this further. I think we're currently in the mindset, when we think about, public will and political will, we always go to public opinion surveys, and and we'll see often for certain initiatives that there's really high levels of support for various initiatives, and yet we get no policy change. And the one that springs to my mind is always junk food advertising to children. Really, really high levels of support for this, around 80% in the community, yet we don't have the corresponding policy change. And I love talking to the public, and so to delve into this sort of anomaly a little bit further, I've started doing street intercept interviews, where you go up to people in the street and just start talking to them about issues, and they're totally unaware and not expecting you to speak to them. And what has been the greatest insight from doing these street intercept interviews is that the great majority of the public have never ever thought about public health policies. They've never, like, you talk to them about sugar sweetened beverage taxes or banning junk food advertising to children, they have never ever thought about these things. And they really have to sit and think and mull over the concept. And, a lot of them, the gut reaction is, oh yeah, that sounds all right. But it's just not top of mind at all. It's not an issue that motivates them, that even excites them, unfortunately. And so I think that there's a real opportunity for all of us, but particularly organisations like VicHealth, to really increase that traction with the public. And I know you're doing great work around framing and using values-based frames, but to me it seems like it's even a step before that, where we're engaging them at that base level and trying to prioritise these issues. And then once we've done that, we need to try and mobilise them, because unless politicians fear a vote being lost, or they're getting inundated with people in their office, it's not going to result in policy change or systems level change. And so I think there's a few steps along the way, other than just connecting with the community. I think there's such an opportunity for them to be partners in driving this systems level change. And I'd really love to hear from Sandro in terms of, you know, what VicHealth is doing and whether there are any plans, or whether he's seen in his previous work successful examples of this.
So, Sandro, do you want to respond to some of the things Catherine has said before we go?
Yeah, no, awesome. And as I said, I'm not a systems expert. I sort of I come at it from you know, a medical field of like kind of understanding what a system is and how complex systems, and that's kind of how my brain works anyway. But it's always great to also have an actual expert as well.
I'm not an expert.
But so a few comments. Absolutely, the issue of power and privilege, I think, is an enormous one, and I think one that we're doing a lot of deep reflection. Every aspect, every part of who we are, how we are, what we do, how we speak as an agency. You know, and that's been a really tough but important journey, I think, over the last 18 months for us. And we're starting to see some really significant benefits in terms of the opportunities to partner more deeply with communities and in different ways. Corporations absolutely are a big, you know, a big challenge. You know, the corporate determinants or commercial determinants or harmful industries, as we call them. You know, when I was at WHO, I saw the worst of it. I was there when the US government put pressure on WHO to change its sugar recommendations. I've been personally attacked and intimidated, you know, tried to be intimidated by a number of companies throughout my time, including even here in Australia when I was a WHO advisor coming back to Canberra. And then interestingly, when I was at EAT, while, you know, there's this kind of urban myth that we took money from industry, that's actually not true. We did certainly work with industry. They were trying, you know, the idea behind EAT was to try and create that almost middle ground where industry can, in a really controlled way, have a conversation with the science sector, and then in a responsible way at the right time, not when policy is being created, but once policy is created, then about implementation, you know, with even the policy sector. I think we did lots of things right, and there are methodologies that are still being developed. At VicHealth, there are a couple of things that we're doing in this space. So the first is we actually do have a whole area of work around harmful industries. I didn't talk about it, but we're establishing a harmful industries hub. We've got 4 fellowships that we're recruiting in at the moment, postdocs that will power a really, I think, a very cutting edge contemporary way of monitoring and understanding the corporate influence for good and for bad. We're also funding a Lancet series on this topic. We also built it into the MJA supplement, you know, so that our approach would be, let's build the evidence to understand, you know, what it is. I think we really lack still a common taxonomy around corporate and commercial determinants. Let's be really, let's look at the evidence around language and all the things that we've done in values-based messaging. We need to understand, well, what is the influence and where and how? So that's part of the monitoring work. And then, of course, we've also done some work over the last 18 months of really lifting our government relations capability. We're actually an independent statutory authority. So we're in this kind of sweet spot where we can have a strong government relations team because we are kind of part of government, but we're independent from government, and we're not a not-for-profit. So we can actually do some of the things that NGOs can't do as well. And it's in the public good, of course. So the Harmful Industries Hub, the Lancet series, and we're also now starting to look at actually using even our programmatic investments. So we are tapering in rules around that is actually based on West Australia work. You know, that basically we won't fund organisations, increasingly we won't fund organisations that take money from what we call harmful industries. So it's again about using the different levers we have of the government relations team, the research investments, the fellowship investments, our pilot and programmatic investments, our relationships with local government, the fact that we're a major funder of sports, arts and cultural sectors, you know, all of those pieces in unison. In terms of, you talked about sort of the science communication, and I think that's, again, you know, when it comes back to kind of the systems based on, I kind of get almost a bit cringy when people say embrace complexity, because I feel like that's a phrase that's been almost overused now over the last couple of years. But it really is about like accepting a level of complexity. But at the end of the day, we do need to be very good at explaining it really simply for the public. And that's where I think personal narratives, qualitative research and lived experience data is so critical. Yes, governments want, you know, ROI, and they want the hard facts in terms of quantitative data, and we need that, but you can kind of give it the colour and the emotion that you need also, even for politicians, at the end of the day, they're people, by bringing that lived experience. And for me, I always remember a couple of people who I've met across the state. I spend a day a week in regional Victoria. When we're not in lockdown, I committed as a CEO from the start to spend a day a week visiting our regional and outer suburban partners. And it's always the stories of the people I've met across those days that are the ones that I really use and drive me, quite honestly, even in the work. The last is you talked about kind of community building, and I think this is a really interesting one, because we have gone from being, if you use business language, we've gone from being B2B to being B2C. So we've gone from a business to business organisation where we were largely business facing within our work, funding others, to now actually being more business to consumer. We're more building a community brand and investing in community building. And so, you know, but you have to be very careful and very considered about that. So, you know, who are you trying to reach? What is the audience? What are the platforms and channels they use? What's the language that speaks to them? What is it that you're wanting them to do? What's the call to action? And then before you get to the call to action, though, it's about building trust. It's about addressing those again, structures of power and privilege of, you know, meeting those audiences and communities where they're at. And it's about making the solutions simple and actionable. And I think probably the best example of that we've done would be our gender equality in sport campaign called This Girl Can. And we're building those insights into Future Healthy as well. And what we found, for example, last year, so as I said to you, we completely reimagined. We've got quite a big social marketing, digital communication and content team, and we completely reimagined that approach. And so we went to a digital first in-house production capability. We really walked away from the kind of, not all of, but far less traditional media, and far more of a focus on higher agility, social media driven approaches. And what we found was that we were able to deliver that social marketing campaign. We were able to deliver it at half the cost, and yet we reached record numbers of women, because it's where women are at. Like, you know, we were careful to make sure that the language was empowering and co-designed. We used, we actually engaged and worked with incredible champions. We call them everyday women, but they're not at all everyday women. I mean, they're incredible community leaders from across the state. We based it on insights that women were telling us that they didn't want to talk about, you know, exercising to look better, or it was about how it felt to them, what it meant to them. And again, it comes back to health is not the same for everyone. So tailoring it to their lived experience and really speaking to their values and priorities, and then delivering it in a way that was simple, with a simple call to action. And the other piece, I suppose, is not only was it sort of, you know, really based on co-design and lived experience, delivered through a digital platform that reached record numbers at a much lower cost. but then it's that systems approach. If you go out with a social marketing campaign and you tell everyone to get active, but then there are no opportunities to get active, that doesn't help. If you go and make a big splash in the media and get government to do and call government out and embarrass them for not doing something, but you haven't done the groundwork to provide the evidence to show what is actually possible, to give best practice from other places around the world, to crowd in the not-for-profit sector, to show that we're a united voice, to make sure that those policymakers have met a few people along the journey in the last couple of months that have lived experience, because of that policy ask that you have, then you'll get the big splash and you'll probably embarrass some people, and then the media cycle will pass and nothing will happen. And it's the same with this. So we not only went out with a campaign, but we also then invested in a huge number of participation opportunities. We addressed the structural and policy barriers that women faced. We made sure that, we worked hard with government to make sure that, the built environments actually provided safe, inclusive spaces for women to get changed, to even get access to sporting fields. We worked with local governments to make sure that women actually got preferential access, not, at night on a Tuesday, but actually proper preferential access. So when we went out with a big campaign saying to women in a way that they wanted us to, with women that identified with them to get active, the opportunities we were also backing it up with those opportunities and with the policy responses that were required. Now, obviously, I don't have lived experience at all as a woman trying to be active. I don't pretend to, and that's again where it was about co-designing it with partners, building a coalition, and that's what we've done with Future Healthy as well. It's about crowding around. We've built a coalition of about 10 of the state's youth peak agencies, and then utilised every aspect of our work, all the different levers that we are able to pull as an organisation, as a policy, with our government relations team, with our research investments, with our programmatic investments as a partner to arts, sports, cultural sectors, and with our social marketing communications, all of those levers in unison around a core set of really clear outcomes.
Sandra, I was really interested in what you said about your role of VicHealth within the system, the broader system, and you talked about your sort of government relations role, but obviously you've pivoted very much the organisation to focus on community. And I suppose my question is, how do you think of your role within that broader system and in relation to sort of government? Like, it used to be called the inside-outside strategy, and how do you weigh that up? But that's a bit sort of a dichotomy, really. It's more complex than that. But how do you decide if something needs a public face, and how do you decide when it needs to be done behind the scenes? Like, how do you think that through? What's the decision process? Well,
and also, if it does need a public face, does it need to be a VicHealth public face? And then is it right for a white man to be the public face, even if it is the VicHealth public face? So these are all questions that we have to be asking ourselves. And again, being very conscious of my privilege. So there's no single clear answer. I mean, I think sometimes our role will be as a funder in the background to resource and support great organisations, great leaders to sort of take the leadership and the fight in some ways to get certain policies over the line. Now, we might in the background still use our government relations team, or we might invest in research and evaluation to protect that policy once it comes into place, or we might pilot something on a small scale somewhere that can then prove to be your kind of proof of concept. At other times, when we've done the homework and the policy window is open, then it is the time for us to be potentially the face of something and really push hard as an agency. We've even tried. What's been interesting is over the last, so unpacking that a little bit. One of the things that we wanted to do through Future Healthy was to even differentiate the different brands or kind of faces that we as an organisation have. So if we're talking about certain public health issues, we will use the VicHealth brand because it's a government brand. It's a very trusted trademark. It's a very, it's a very kind of steady, relatively corporate, but certainly very government brand. What we wanted to create with Future Healthy was actually something that could be agile, that could be youthful, that we could take some more risks with, that was colourful and bold, and that really spoke to young people. And so Future Healthy will sit across about 40% of our work. And what that's also allowed is it allows differentiation from sort of VicHealth and almost a level of handing over ownership to our partners and to the community and to young people. It also allows us to reach and be relevant to young people in a way that we wouldn't be able to with our own brand and approach. And it also allows then for others to join that brand or to join that approach and to say, we're a different organisation, but we believe in the vision of Future Healthy, which is linked to VicHealth. But at the end of the day, we don't own it; the Victorian public does. So that's been kind of interesting in itself, is creating sort of almost a sub brand that allows us to then be more inclusive, to be more proximal in our work, to allow more local ownership, and to really also to take greater risk, because at the end of the day, if you're wanting to disrupt and change the system, there is inherently quite significant risk, because you're going to have to do things quite differently. And so that allows you to take risks sort of under almost a separate brand.
Slightly arm's length risk taking.
Yeah, and it's the same with even myself, because sometimes it's really helpful to have a doctor or to have a person. People connect with people rather than brands in a very different way. And for us with Future Healthy, we have 14 amazing young community champions from diverse lived experience who will be the face of that campaign. So that's not about, that's a $45 million investment in Victoria's young people. It's not about me or VicHealth being the heroes of that story. We really want from the start, it's a separate brand, it's co-designed by young people, and there are 14 young champions who will be the face of that 3-year investment and campaign. And that again allows us to really much more truthfully, I think, engage and have important conversations, build trust, and therefore be able to influence the systems that impact the health and lives of young people.
Oh, that's great. Thank you. We do have a lot of questions coming in. I'm very wary of the time, but I do want to give you an opportunity, Catherine, if you had any thoughts or reflections on what you've just heard, or any follow-up questions.
No, I don't have a follow-up question, but I'm just looking at the questions coming in as well and picking up on what Sandro was saying. The importance of trust in organisations is so crucial, and I think maybe if we go to the questions here, and I have a sense that that's going to be a really important component in terms of engaging with the public, engaging with policymakers. Trust is really at the crux of so many of these issues, and it looks like VicHealth is doing an amazing job trying to ensure that trust is maintained throughout all of their interactions, which is great to see.
There's one question here I'll put to you, Sandra. It's what happens when an evidence-based policy reform isn't popular or well supported by the public? What can you do and what should you do?
Yeah, I mean, what's interesting is, as you mentioned before, Lucy, like most of the really important progressive policies that we would all love to see happen are actually supported by the public, but they're just not supported necessarily or not possible politically at the moment. And that's a more likely position. If it's something that's not supported by the public, I think it's then we need to kind of again, it goes back to self-reflection. Why is it not supported by the public? Is there something that we're missing in our own, potential ivory tower if we put ourselves in their shoes, what is it that's standing in the way? Because most of us would not be arguing for something that's regressive or that's immoral or that's not fair. So, they're probably policies that once you unpack what the challenges are, or whether you can repackage it or communicate it in a different way. It struck me recently when I was speaking at a conference just how how hated the word policy was for an audience. So I was at a social change conference, and I'm used to coming to conferences or meetings like today, and we all probably love the word policy, like it's one of our favorite things, you know. Whereas this group really hated the word policy. For them it was a really negative word. And so when I unpacked it, it was because it came with all of this baggage related to their lived experience that was not mine. And so if I changed it instead to, government leadership, or even collective leadership, or even just talk about the actual thing we want done rather than giving it all these fancy technical words like fiscal policies, then suddenly they were really supportive. So yeah, so I think it's kind of doing some deep reflection on, well, why would there be such a disconnect between something that a public health community is wanting and what the public wants or believes? And then, how do we slowly chip away at changing, at influencing that? Or maybe it's also for us to rethink. Maybe there are certain policies, again, it's about that the outcome should be concrete, but how you get there should be flexible.
That's a nice segue to one of the questions that's been voted up to the top, which is, so you talked about keeping the what clear and the how flexible. And so the question is, well, how do you actually do that? How can government support that in ways that don't kind of return to the purchaser-provider model and only the government deciding on the what? What's the best way of doing that, achieving that goal?
Yeah, well, I think, again, there are lots of really amazing methods that Australian institutions have been at the forefront of developing around community consultation, co-design, even like what we're doing at the moment, which is about, so we've sort of brought together, the 8 youth peaks. We've got an expert panel of young people, and then we've also got this wider crowdsourcing sort of population-based model, and it's really the aggregate of all three that will influence what are ultimately the solutions. But if you think, like, for us, the what would be increasing access to affordable, fresh, healthy food for Victoria's young people. So we've seen a big increase in food insecurity, doubling during the pandemic. Young people have been particularly hard hit: single parent households, Aboriginal, Torres Strait Islander families, regional families, bushfire affected communities. So if that's the outcome, then what are the package of interventions? Some of them might be policy, they might be programmatic, they might be, it might even be, certain pieces of research that need to be done. How do you build the case for some of those policy pieces? What place-based solutions exist across Victoria that we can learn from and adapt and scale up? So that's where I mean, it's not to say that the way to that it's a certain policy and that's set in stone, and now we just need to work out how we get that policy. It's actually taking the step back again and saying, what is the outcome you want? What is the population benefit that you want? And then what are the huge constellation of levers and opportunities that might get you a step closer? They won't get you all the way, but they'll get you a step closer. And if there are some policies, they might take 5 or 10 years. Nicola Roxon's my chair. She was literally just 10 years ago, this week was when she presented plain packaging to the United Nations General Assembly. Now, that process took more than a decade, and again, I know I'm speaking to some of the foremost policy experts in the country, so, apologies, but it might be that the policy things take a long time, but in the meantime, you can, build an evidence-based or start to understand more about the lived experience to have that really qualitative, rich data that's so compelling. Or it might be that they're actually, again, if we look at the pandemic, we knew the outcome was getting more people vaccinated, or it was getting more people tested, or it was, increasing adherence to the public health orders. And what we realised actually was the place-based approach, listening to local leaders, really valuing community strength and insight, and listening to communities, and then, using those insights as sources of solutions that can then be scaled. That's actually been, I think, one of the key learnings, or one of the things that we've learnt once again. So keep the outcome really clear, but be agnostic as much as you can be about how you get there, which is hard for us in the public health community because we do have incredible biases. You know, we're either policy wonks, or we love quantitative data, or we love, certain co-design methodologies. That's all really great and important and rich. But at the end of the day, we want the outcome. So keep a level of humility and keep a level of agnostic intent.
Catherine, any thoughts from you? I know you've been studying how advocates can influence policy, and any sort of reflections or response there?
No, I would thoroughly support what Sandro is saying, and I guess the key thing for me too is just to consider, as I mentioned earlier, in terms of when we are speaking to the public and understanding their perception is really, really important. But I would say, be careful how you recruit those people to get their opinions, because there's a special type of person who puts their hand up to, come into a university or into a government agency to provide their views on a policy or an issue. And so I think if we can find people in, real life as much as possible and speak with them and find out their concerns, and maybe that's going to agencies working on the ground. Maybe it's engaging with organisations like Parents' Voice, or fantastic grassroots agencies who are connecting with people on the ground. That's where we can get the real insights, and I would be prioritising those.
Yeah, I would totally agree, and I think and thank you for that. I think for me it really is, and again it comes back to privilege, but to be able to spend a day a week of my time to I realise that's enormous privilege to be able to do that, but it's not a nice to have, it's not a tick box exercise for me. It is I learn more on that single day in regional Victoria about my organisation and how we can do our jobs better to serve Victorians than I do the other 4 days easily. And I would also echo, the partnerships that we've strengthened over the last 18 months, organisations like VCOS, so ACOS equivalent here in Victoria, the Ethnic and Cultural and Community organisation, ECCV, and of course Parents' Voice. So really grassroots representative organisations that reach thousands of organisations themselves. There are ways of doing it at scale for government agencies, but really I think, again, it's about building trust and respect, being very clear that experts in organisations like VCOS, experts in organisations like ECCV, and actually coming back to the policy question, we were recently doing some work around wellbeing economy. VCOS is such a powerful ally, such an important ally. The Victorian Council of Social Services, of course they should be the leading voice in arguing for a wellbeing economy approach, but we will support them, we will fund it, we will be there every step of the way and an equal partner. But they are the ones that represent those important constituents. And I think it's the same that we've seen in the climate movement with regional and farming communities. It's about really listening and understanding who are the meaningful allies, how can you work with them, and not tell them how to do their job, and public health doesn't have to lead, because at the end of the day, again, it's about getting the outcome, getting it over the line. It's not about ego or about who did what along the way.
Wonderful, thank you. So one question that, again, another one that we haven't got that much left, but I think we should ask this one because it's sort of what can we learn from COVID? So particularly in relation to people's views on policy and how strongly they can be engaged with some of the policies, as we've seen, it's been demonstrated. So what can we learn from that in public health and prevention?
Holy moly, that's an hour, but very, very quickly. So we stand at a crossroads. 2030 is not that long away. We've got Paris Climate Agreement. We've just had this massive shock to our modern system, every aspect, economy, work, life, learning, everything, technology. And I really think that combined with the fact that health is front of mind in a way for populations in a way that it hasn't been for a long time, the fact that public health is front and centre in a way that it hasn't been for probably a century, the fact that people know what an epidemiologist is and that they are a trusted expert voice in society on a daily basis. You know, many of us used to argue or think of, gosh, imagine if there was the day when some sort of public health measure was on the news each night, like the weather. You know, well, that's the world we live in now. So the question is, what comes next, and how do we reimagine life going forward? You know, we have taken a snow globe, you know, of our modern system, given it a massive shake, and the snow is now settling. And I think where that snow settles in the system and how that shapes the health of future populations has to be a huge challenge and opportunity for the public health sector. And yes, you know, the infectious disease experts need to continue to focus on COVID, but I would hope that many of the agencies on the call, like us, have been preparing and thinking and positioning and seeding and strengthening the opportunities and the strategies and the what that will come after COVID, and how we use this as an opportunity truly, I think, to build back fairer and more sustainably and healthier for populations. This is the system's, you know, disruption that I think allows us, instead of that tiny incremental steps that we've had probably in the wrong direction for decades, it allows us potentially, if we play our cards right, to have that big leap forward.
Wonderful. That's a very inspiring thought. Catherine, anything from you? Final reflections?
I would just say with COVID, I've been greatly heartened by the public's engagement with it and their support of public health policies generally, particularly up here in Queensland. We love, you know, we're still wearing masks and we don't even have cases up here. So we're really into it. So generally, I think it's been really, really heartening to see the public embrace those public health recommendations or requirements, depending where you are. But then I would also say, in terms of that vehement opposition, I think that's also really shining a light on how the media will pick up on a tiny minority and amplify their voices, and how, you know, we've got to be thinking about how we can compete with those voices and compete with that media attention there, because it's a really unequal representation of how a very small number of people who are vehemently opposed. So I think that's just something for us to take forward going into the future, thinking how we can compete with that media time.
Totally agree. Yeah, good points.
Any final thoughts, Sandro, before we finish?
No, I think absolutely. I think there are huge risks and there are huge opportunities. Like, the stakes could not be higher. Where we need to be, where we are now, and the disruption in our system. You know, I think now more than ever, we need strong systems leadership in public health. And I think that the time for setting a stronger vision of where we can be, again, stakes have never been higher, but the opportunities have never been greater. So, you know, I think it's a great time to be having this conversation.
Yeah, I totally agree with you. And we're very grateful that you've come back to Australia to be a part of the change. So I think we better finish up. 1 minute to go. So I just wanted to say thank you so much, both Sandro and Catherine. That was a really wonderful conversation. So many questions still coming in. I think we could have talked for another hour, but unfortunately we have to finish. So just thank you so much. It's been wonderful, a wonderful way to finish Prevention Works Live for 2021. And we'll see you all next year, hopefully with some more change makers sharing their experiences and wisdom. The recording will be available, or should go out, I'd say, in the next few days. So if you want to share that with some of your colleagues and partners, you can listen to it again. And also, if you want to learn more about the work of the Prevention Centre and some of our partners, then just encourage people to sign up to the Chronicle, which is on our website. So again, thank you, Sandra. That was really great. And thank you, Catherine. It was wonderful. So thanks so much. And I'll say goodbye.
Thank you.